are going to have to cherry pick some of the promising projects, for example, 2 to 3 projects, by securing the data for so far, and then we'll compare how efficient it'll be as it was combined with existing options. And by doing this evaluation, we will be able to choose more likely and effective vaccination to provide necessary support. And after these projects are chosen, of course, we will support that clinical phase 3 can end successfully. And for a fast adoption and fast development, we need to adopt these strategies. But at the same time, our team and our center also supports non-clinical field as well. Even though we're going through an initial stage, the main aim and goal for the COVID support project is that number one is whether it can effectively respond to variants, and number two is how we are going to make it into endemic. And also, number three is, let's say another round or wave of pandemic hits, how we're going to successfully respond to it. Number one, we have to focus on having technologies to respond to various variants. And if there's another round of pandemic, whether we're going to secure resources for that or not is another objective. And number three, we have to make sure that we develop fundamental technologies and equipment so that we can prepare for different possibilities and chances. And we would like to secure new technologies and labs and R&D centers and universities so that they can work on future responses. And another thing I would like to mention is with the companies that have technologies. And also, you have to think about manufacturers. By creating consortium between technology holders and manufacturing technology holders, we have to expedite the commercialization of new vaccinations. This is what I would like to emphasize. In order to go to the global market, they need support, and we're going to support it. And even though, let's say, a company has a fundamental or base science technology, they might have a difficulty commercializing those technologies. So, by providing an opportunity to create a consortium with other companies, they can quickly and expedite the process of commercialization, and this is a strategy going forward. And next, I want to talk about some of the treatment options. As for COVID-19 treatment options, if you look at some of the options suggested for antiviral segment, remdesivir is the only approved treatment. Remdesivir, if you look at the efficacy, there is some controversy over whether it is actually effective or not. And if you think about other medicinal options, they are being developed, but you can see that some of them are not going very smoothly, but others are going through clinical tests as well. Now, let me move on to the immunomodulatory agents, and the most representative would be dexamethasone. Of course, this one has many advantages, but there is a clear limitation because it's an immune steroidal side effects. There are many different materials that are going through immuno technologies, but I would say even immunomodulatory agents are not recording great success when it comes to proving its efficacy. And I would say the most developed option will be monoclonal antibody treatment. As you know, Eli Lilly or Regeneron, these are the ones that received EUA in the US for high-risk patients. But in the case of monoclonal antibody treatment, if you think about its nature, when variants appear, it is difficult to apply them with the same efficacy. So what we currently do is we use IV in vitro method to inject this treatment material, and we can only use it to limited patient groups. That would be the main limitation that this antibody treatment option has. And again, other options are being developed in the monoclonal antibody segment as well. And next, moving on to hyperimmune globulin and also convalescent plasma. When it was first launched, people have expected that there is going to be a great result, but as of now, I think this is not going very smoothly. Hyperimmune globulin's expectation has been dropped significantly. And now let's go back to the treatment options being developed in Korea. Zeltrian received a partial approval, conditional approval in Korea, and now it's going through clinical phase 3. And Daeung offered two options, and Chonggundang CKD Pharmaceuticals also suggested an option. And these are a reproduction method. And Shinpung, Donghua, and Pogwang, and about 40 different pipelines were generated and now are going through clinical test phases. But what is unfortunate is that antiviral products were not approved so far, and also for novel drugs, only Kirona is the only option that was approved by KFDA. And now let's move on to the development product trends. If you think about July last year, to tackle new COVID coronavirus 19, there were materials that were targeting only coronavirus. So more than 50%, about 53% of materials were targeting only coronavirus, and redirected ones were about 27%. But if you think about what is happening this year, antiviral active materials, the new projects, are about 70%. Meaning, like the projects that are targeting this coronavirus itself is growing, whereas proposed or redirect projects are reducing in number. So if you think about COVID-19 treatment development trends all around the world based on scientific and technological elements, we are focusing on developing a new material that can specifically target COVID-19. So these COVID-19 targeting materials are about 30 in terms of its number. Of course, these types also include treatments, but mostly it's antibody or protein recombination. Many different approaches are taken. And now I want to talk about some strategies that our center is focusing on. Just like treatment options, there is urgent use purpose and more mid and long-term based approvals. So for the urgent approved ones, we need to think about the usage of combination therapy. There are available options in the market. And then by co-injecting both the available options and the new vaccination, we can develop strategies, and this can be accompanied by a joint R&D project, and cooperation methods could be invented. And another thing is for COVID-19, and depending on the severity of COVID-19, for example, mild or moderate or severe patients, you can have different portfolios for different groups. So we need to have a strategy to segment those portfolios. And another strategy for treatments that I would like to talk to you today is, of course, whether we have to look at whether it can respond to variants, and number two, whether it can prevent next wave of pandemic, and also another part would be responding to endemic situation. We need to identify new materials for variant response, and number two, we need to identify new materials for other rounds of pandemics in the future that'll be a different kind from COVID-19. And again, in order for us to complete these strategies, we need basic and fundamental research projects. We need to create a support system so that we create an environment where a number of diverse research and studies are being carried out. So, this is everything from me. Thank you very much for your attention.
Thank you, Doctor. It was a presentation by Dr. Young-Gun Liu on the theme of Session 1, Development of Domestic COVID-19 Vaccine, Therapy and Strategies for Global Advancement. And he talked about current status of development of COVID-19 vaccine and therapy in domestic market. Now we'd like to move on to the discussion. As debaters, I'd like to introduce Yang-Gun Liu, PhD, Principal Scientist, R&D Division, Korea Drug Development Fund, and Taekwon Oh, PhD, Director of Research and Development of SALID. So we just brought two panelists on the stage who will participate in the discussion to the stage. They will talk about the topic of this first session. So seems like we are ready. So please proceed with the discussion.
Good to see you, everyone. So I'll begin the session 1's discussion session from now on. Today's topic is about development of domestic vaccination and its expansion to the Korean global market. And I am Dr. Yu Young-gun from Korea Drug Development Fund, and here I'm joined by Oh Tae-kwon, Dr. Salid of Researcher. Hello, good to see you, everyone. I'm Oh Tae-kwon, a principal researcher from Salid, and thank you for having me here. And to mention briefly about Dr. Yu, and then I'll also cover those vaccination development, and also I'll cover global advancement of Korean vaccine. Right, so I just delivered my presentation, and Dr. Oh, which specific parts did you pay close attention? Any ideas, opinions? Well, so far in Korea, there are COVID-19 vaccine developments, and you covered it really well. And in terms of different types of vaccination, the Korea Drug Development Fund strategies, your stories about it was really meaningful. But we have to also discuss how we're going to work on this global advancement and how the Korea Drug Development Fund has been working on it. And you have your background knowledge. And from our company's perspective, we would like to get some piece of advice and have a cool partnership to expand to the global market. And there are a couple of things to mention during this discussion session. And like you said, Dr. Yu, in Korea, in terms of quarantine, we are receiving a lot of compliments that we are taking good countermeasures. However, in terms of vaccine development, we are kind of late compared to other countries. However, despite that circumstances, we are currently working on antibody treatment, and you got approval. And the reproduction strategy for treatment, you're taking two strategies, and working on this in a timely measure is something that we had not seen in the past, and the Korean pharmaceutical companies, the history, and how we could come up with this in a rapid, timely measure. What do you think was the reason?
Yeah, well, within such a short period of time, because I'm on the front line and because I manage these projects, I think in such a short time we have achieved that status. And I would say the main driver for that was we have to have the basis, we have to have the fundament, and we had that. In the case of Celltriant, in such a short time span, Celltrion detected and identified the material and also successfully produced the material and win the approval as well. And of course, there are other materials too. There were already developed, pre developed materials. And even though they were actually targeting to use the material for other purposes, they would redirect the purpose so that it could be also used for COVID-19. And that approach was only made available and was able to be provided to us because there was ongoing fundamental research.
Well, I do agree with your opinion, and specifically, so far, the pharmaceutical industry, in order to propel its business from the Korean government's perspective, we have been investing in the industry, and that is propelling and acting as a catalyst for this timely development. And we will also receive that benefit too. And so, in that terms, I personally think that that indeed was a good policy measures. And meanwhile, in terms of vaccination, currently, when the COVID-19 was began its outbreak, and it was from at the later last year, and when we worked on this operation and we worked on excelled this development, and we did get approval. And for our company, we began working on our pipelines. However, we have not clearly entered this market yet. So, which parts was specifically difficult and challenging for you?
Maybe I'm repeating myself, but at the end of the day, I think we have original technologies and like how much original technologies we have had secured. That's the most important part. If you think about mRNA vaccination technologies, these were available since 1960 in the US, and because of that research that had been done in the past, and by adding newer technologies to those ongoing research when things were urgent, based on that history, they were able to develop an mRNA vaccine. And another part is regulatory science. There are firms who own those technologies, and of course, they're going to develop those into products. But then, what kind of guidelines are you going to provide as an FDA, as a regulatory body? For example, let's say they're doing clinical 3 stage, and you have to give adequate guidelines so that those phases can be finalized successfully. And I think that expedited the whole process.
And I highly agree on that point. And I personally, for Moderna or Bushu, those company developed vaccination based on their mRNA, and AstraZeneca and Janssen are working on their vaccine development. And when I take a look at those companies and your aforementioned entities who are taking these timely measures, and they got rid of a lot of uncertainties in the future. So that is my personal opinion. So I do extremely agree with your voice. And as developers ourselves, in the early stages, the Ministry of Food and Drug Safety, its authorities, highly focused on vaccine's safety, and that is what the implication that I had. And when we prepared for this vaccination, and compared to the vaccine development overseas, we couldn't catch up with the speed, and that was really depressing for myself. However, currently the KFDA is taking some open-mindedness and taking a lot of scientific measures, and thanks to that, um, they're putting a lot of efforts to actually achieve the development of vaccination. And this private and public sector's cooperation itself, on top of working on developing it, but they are taking baby steps and to taking grown steps, and they're supporting us a lot. So this is making a great change indeed. That is my opinion. And so far, just like you just said, when you take a look at overseas vaccination and pharmaceutical companies, they are coming up with new platforms that is very different from conventional platform. And we are working on adenovirus viral vaccine, and AstraZeneca. Usually, it used not to be a COVID-19 vaccine company, and not to mention Moderna, because it was a biotechnology company, and no other new vaccination based on mRNA had got approval in the past, so it is very surprising. And Pfizer is also very surprising. How Pfizer um, did succeed in using this unauthorized vaccination? How did they work to come up with the vaccine with that? So there will be different opinions. However, I did pay a close attention with a lot of interest in that issue. And currently, the adenoviral vector is was developed for the first time ever as a gene treatment. And of course, many companies try to use it as a vaccination. But before commercializing this idea, adopting, combining it with the vaccination, it does tell many different things, implications to us. And you have also mentioned it, the um, that vaccine or subunit vaccine, among other safety issues, have been approved in the platform, and the gene utilizing platform has been switched and combined with the conventional market, and this conventional biopharmaceutical industry adopting this new form of market, and it's transforming this. And in the future, if Korean pharmaceutical companies were to use this vaccination to expand to the global market, then we have to think about this market strategy. And what is your forecast, sir?
Yes, as you mentioned, vaccination market is definitely turning into a state-of-the-art pharmaceutical technology market. But we're not saying the recombinant vaccines are bad because we've used it for a long time. There has been long verification period that we can trust. But instead of just following the step that we took in the past for fast variants, or let's say we can add a new technology so that the conventional methodologies can be developed and be updated in the future. And for viral vector vaccine or mRNA vaccine, which are relatively newer than the others, we were using this in order to come up with a DNA therapy. And because of the pandemic, the outbreak of the pandemic, we had to divert the focus. And basically, they had an opportunity to go through the safety test using global population. And I think this technology will be transformed into gene therapies or state of the art treatments, and they will use this as a great opportunity. And of course, vaccination for infective diseases is important, but you can also think about a chance of developing cancer vaccination or other rare disease therapies as well. And another option would be from the gene therapy industry. I think it's going to go through a big transformation, not just the vaccination, but also for treatment options. Major shifts are expected, And if you think about Korean biopharmaceutical companies, we need to be very diligent when it comes to accumulating those relevant technologies. And as I mentioned earlier, if you have this fundamental and original technologies, in order for these technologies to be commercialized, you have to work for another mechanism. So you have to have a base for manufacturing and production. So a strategic approach is necessary. So, and also, if you just have the production base or facilities, that is not enough. You have to also accumulate expertise and know-how, because without materials, the facilities are not so meaningful. So you need to come up with the strategies to combine two these different areas.
So thank you for sharing your ideas and their pledging and Dodge. Those kind of strategies are needed. And we as a developing company for vaccination, it is really difficult to equip ourselves with manufacturing facilities. So we are taking efforts to collaborate with that technology. And as you have before mentioned, the vaccination industry is a very conventional market. And if we consider these characteristics, then it is considered as a public market. And if we do not share this technology with the WHO, then it is really difficult to develop this market. And if we working on this public market, then if we it is really difficult to get recognized for this premium technology. And so if this advanced technology enters this market, then it is very difficult to work it and expand it. And especially for new technologies, they would usually companies cannot choose other options, but rather they jump into the private premium vaccine market. However, currently, if this vaccination can be provided with reasonable prices, then this can actually replace the premium vaccine market. And have you ever thought about this?
Yes, because of COVID-19, premium vaccinations, so-called premium vaccines, are being discussed, but initial costs are very high, as you know. But because, realistically speaking, COVID-19, global population has to be injected with COVID-19 vaccine. So, in terms of the amount, because they have to generate so much vaccination, you can consider that development costs could be offsetted by the generated volume of this new vaccination. And as you mentioned, the as the fundamental technologies are secured by different and a number of manufacturers, they are going to be reused for other purposes and other applications as well. These are not going to be cheap or affordable vaccines. It's going to be more for premium vaccine solutions. So I think the future is very bright.
So so far you have been sharing a lot of good ideas. And thanks to this COVID-19 pandemic, various advanced biopharmaceutical technologies are being combined with the vaccination, and they're coming up with a lot of achievements. And there probably we will also see more opportunities in the future. And if we take those opportunities or potentials into consideration, is there any piece of advice that you would like to offer?
Yeah, so I think I have been saying it multiple times over my presentation and also over my talk. Technologies are important, but they're being stopped and halted. I know it is a very difficult and tricky process. And even if you own technologies, commercialization hurdles are relatively high. That is why we call those vaccination hub. It's not just a mere production or manufacturing. It is also, you might think that all you need is facilities to produce those, but you have to also accumulate know-how and expertise on deploying those technologies. So let's say there's a company that wants to produce a specific product, and realizing or commercializing those products, that production technology itself is important, and these two different parties have to create a consortium so that they can jointly enter the global market.
From biotech's perspective, when we worked on developing this vaccination, and of course, there are various challenges, and we are actually experiencing them, and how we are going to overcome those challenges. So we are currently getting a lot of advice from KDDF and Korean government bodies. So I would like to deliver my gratitude to all the entities. And recently, President Moon went to the States, and he recently delivered a speech that Korea will be a developed vaccination hub. And currently, we are really managing to deal with COVID-19 well, and we're currently developing a lot of vaccination. And in terms of vaccine, just the on top of the conventional platform, we are also making use of adenoviral vector, and there are many companies that are taking this mRNA platform. So I guess I would say that there are a lot of opportunities. However, like we just said, from the baby step from developing the technology and to the stage where we will expand to the market, there are various steps that we have to equip ourselves. And however, there are some challenges and lacking characteristics. And in order for us to go global, if there are any lackings or challenges, what would that be?
Yes, so if you think about the conventional recombinant vaccine technology, I think Korea is good enough. Our technologies are good enough to go global. However, as you mentioned, if in the case of mRNA or new types of vaccination, we do not have that capabilities because we haven't commercialized those vaccine options yet. So, and this is not something we can gain within a short amount of time. So, I think investment and relevant research has to be provided and supported and be carried out. As I mentioned during my presentation, our institute will focus on responding to new variants and also responds to endemic and also the next wave of a pandemic that is not COVID-19. And are going to come up with support measures for those attempts.
And I highly agree with what you have just said. And the modern day vaccine companies are actually, there are some companies that passed the WHO's qualification processes, and the production facilities and capacity. And I would say that there are parts that we meet the standards, and the new platforms, including mRNA and adenoviral vaccine. And if do we actually have capacity to equip ourselves with those technologies? And the Korea Drug Development Fund has delivered ideas, and they are currently supporting the global vaccine platform, and there are vaccines currently developing. And thank you for supporting the clinical phases. And currently, the Korean government's funding and is working on manufacturing platforms. In the past, there weren't so much. So I personally feel that the fundamental technology and working on pipelines in the past, there were various research programs, and there it is a fact that there were various pipelines, and there were many preclinical phases. However, in reality, after that process, if you fail to find any partnership, then it is really difficult to survive. That is the effect. And how are we going to reach the commercializing process by equipping ourselves with facilities. And for adenoviral virus and mRNA, which companies have what kind of technologies, depending on that fact, their sales revenue differed really much. Moderna and Pfizer, if you take a look at their sales, their performance differ, and I personally think it was because of their fundamental equipment and facilities. So people may think, isn't it all the on companies themselves? But if you want to come up with this manufacturing facilities, then I would like to ask KDDF to provide a lot of support for that. And there are some dispersed characteristics, and if you create a consortium to collect them, and KDDF has a lot of information, so in terms of this, if KDDF formatively takes efforts to collect this and provide support, then that will be of a lot of help. And in the future, let's say if there is any new mutated virus or anything else, what do you have as a macro perspective?
Yeah, so our institute is specifically our team is managing COVID-19 situation and trends, and as I already mentioned, original technologies and variant response measures were supported by our team. For a new type of infectious diseases, we have other departments and teams that are engaging in a number of projects, and especially we will focus on securing original technologies. We have R&D, a support platform, and we have been building this platform. We will continue to work harder.
Thank you very much.
네, 시간이 거의 다 된 것 같아서요. 마무리해 주시면 좋을 것
So,
같습니다.
thank you for
Thank you to
wrapping
all
up.
panelists for their discussions. Please give them all another round of applause. They have discussed in depth how domestic COVID-19 vaccine and therapy should be developed in line with the global advancement. Thank you very much. And now we'll move on to the next sequence, which is company presentation. Kwang Soo-shin, the research scientist, Research Center of Salid, will bring us a presentation. I'd like to invite him onto the stage. Please welcome him with a big round of applause.
Good afternoon. I'm Shin Kwang-soo, principal researcher at the Salad Research Center, and I would like to deliver my appreciation for giving me an opportunity to present here. Thank you, BioInvest Fair staff members. Today, I would like to cover this ADCLD COVID-19, the vaccine that we're currently working on developing, and I will deliver details. This is the status quo of development, and Dr. Yu has covered this well, so I'll just skip on this slide. And we are currently working on adenoviral vector to work on vaccination, and that you can refer to page 128. So I'll briefly introduce our vaccine. So these adenoviral vector, which makes people catch cold, and we make use of this. And if we get rid of this part, the circle part, and then this virus cannot activate cold anymore in the human body. And to this part, we use this spike gene here, and we switch that part into 85 and 35 hybrid vector. And the efficacy followed by this is two. And one is that we introduce this knock gene, so we can effectively create an anti-gene body here, antigen. And if we make use of this virus O type, then there are some worries that if we use this in vivo, then there will be some, maybe some counterparts. So we can mitigate that risk, and we came up with this vector, and we made this SARS-CoV-2 spike gene as an antigen for the vaccine. And if we inject this spike gene, then we can come up with the vaccine. And I'll move on to the mechanism of action. And like I said, this vaccine uses this type 35. So when observed in the human body, then it can be adopted to this part. And if you adopt this, then within the cell, this vaccine antigen in the vector can create this immune system, and the protein created here that will work as a catalyst to prevent the infection and activate the T cell. And even if the human body contracts this virus, you can preemptively kill this virus. And the strength of this adenoviral vector is that you can kill and effectively induce those desired efficacy. And on top of that, we make use of spike protein expression, and we have our unique antigen. And we conducted some research, and thanks to our technology, when we made use of this antigen within the cell, you can come up with this wild antigen. Compared to that, we can effectively come up with antigen more successfully. And this, if you take a look at this slide, in the animal's body, the combined vaccine, the antigen, showed higher efficacy, so we can effectively work on this. So we named this ADCLD COVID-19 and kept working on research. And then I'll move on to the immunogenicity of ADCLD COVID-19. And through our tests on mice and monkeys, we saw this effective results. And we conducted T cell analysis. And when we injected this vaccine, we saw that CTL vaccine was well activated and it killed the virus, and it was well activated to the antigen and it absorbed to the body. And the T cell that is well activated can induce this antivirus, and also these T cells showed Th1 and Th2 responses, and there was significant good T1 activation. So we came up with Th1 reaction, and we shouldn't induce Th2 activation. So we focused the T cell reaction, which is highly concentrated on Th1. And based on the research results, we conducted protective efficacy, and we used this transformed mouse strain. And after vaccination, and we exposed the animals to the COVID-19 and saw this reaction. And there were control groups of vaccine 1 and vaccine 2, and depending on the number of dosages, we saw if there are any significant differences. And as a result, the comparative group, after getting the dose, their weight kept decreasing, and when they died, those mice got vaccinated, recovered in the early stage, and none of the mice died. And despite if getting one single shot or getting twice, they showed this efficacy. And also in terms of lung types, if we saw if there is any virus, and until treatment, the mice kept showing this virus. And if we vaccinated these mice from the third day, they didn't show any virus. And according to these research results, we saw that this mice experiment showed that our vaccination successfully decreases COVID-19. Next is our test on monkeys. We used the same measures on monkeys, and we induced this ELISA and neutralizing assay, and just like them, only with a single shot we showed this result. And the T cell reaction was well induced as well. And things after this successful immunization, after 7 weeks of treatment, we exposed this monkey to SARS-CoV-2 virus, and after this exposure, each day we collected this sample and we analyzed this, and those monkeys till the 4th week. Those not vaccinated monkeys were kept getting virus. However, those vaccinated monkeys didn't show any virus. And even the lung samples, those vaccinated monkeys, all of them did not show any virus. So at the animal experiment level, we came up with the result that it is meaningful. And we conducted phase 1 and phase 2A, and we got authorization approval, and we are currently working on further development, and currently we are working on 2A phase, and we have completed 2A, and currently we're working on collecting samples, and if we complete that process, and we will be able to move on to the next stage. So today I will elaborate the additional analysis on phase 1. And for our phase 1 study, we categorized into 3 different dose levels, and we conducted this research in a timely measure, and we worked on 3 different groups: low dose, mid dose, and high dose. And we monitored those safety measures, and we worked on neutralizing antibody and T cell reaction, and we are currently working on this. So today I'll cover safety measures and post-vaccination neutralizing AB. So first of all, let's begin with safety measures, and it shows a lot of safety level. And if you take a look at the side effects, there were some levels. However, if you take a look at the grade 3, that there was no different challenging moments, and there were only 2 or 3 cases that showed side effects. And the most commonly side effects is just pain or tenderness. And this is something that commonly is monitored when vaccinated. So based on our judgment, our vaccination does not show any serious side effects compared to other vaccines. Next is immunogenicity. And if you take a look at the antibody binding AB titer, based on all the 30 samples, you can see that the combined antigen were detected here, and it increases accordingly. However, if you take a look at this mid dose and high dose, on the 4th week there is less difference, and that is because there were only 10 samples from each group, and if we secure all the results of the 2A phases, then we will come up with further detailed information. And here is anti-RBD binding AB titer, and from all these samples, we saw this significant change. And just like spike gene, and it increased in accordance with the dose. However, since there were only 10 samples for each group, so we need more samples. And this slide shows SARS-CoV-2 NAB. And likewise, just like the previous slide, we saw this significant improvement, and we have successfully induced this. And in terms of math, there were 200, from low dose, and 427 from the mid dose group, and 490 from the high dose group. And as you can see from the slide, if you compare the mid dose group and high dose group, there is no significant difference. So after the two-way phase analysis, we will come up with further details and come up with math. So in summary, the vaccine that we use it uses adenoviral vector, and it transforms the AD35 NOP vector, and the antigen uses our unique patent item to work on it. And our vaccine showed T cell reaction and nitrogen reaction based on both mice and monkeys. And from both animal groups, it significantly prevents the virus. And so far, we are currently working on analyzing phase 1 and phase 2A. And the interim results of phase 1 tell us that 100% from all the samples showed that the vaccine neutralizing results were shown. And next is our plans in the future. And as I said before, we will soon complete the two-way phase process and analyze it. And we will soon begin
네.
our process development and process validation. And there will be some challenges collecting samples, so we are currently working on collecting more samples from other groups as well. So thank you for listening.
Thank you, research scientist Kwang Soo-shin, for
네,
his informative presentation. So please send continuous interest and support for growth and development of SALID. Next, there will be a presentation by Eun-ju Jung, Principal Researcher, Manager of Biopharmaceutical Center, Eng. Now we have Eun-ju Jung on the stage. So please welcome her with a round of applause.
Good afternoon, ladies and gentlemen. My name is Eun-ju Jung from SHK Eng. As the previous speaker said, we have a different vaccine product. We are utilizing recombinant vaccine measure, and let me brief you on what kind of technology we have been developing and adopting. So, because many of you might not have heard about our company name, let me introduce the name first. N is a short for Innovate New and Next. And we were once included in the CJ group, and then now came back to the Hyungwon group. And we would like to become a leader of fewer core businesses in the pharmaceutical fields, and we would like to actively adopt growth engines for a better future and to create high values. Currently, about 150 researchers work at our R&D center, and we have biologics research segment and chemical evaluation and analysis development, and each center has these subgroups. And our center also provides biologics-based product development. Now, moving on to the manufacturing site, we have largely 4 main facilities, and biologics is located in the Icheon plant, and other chemical or imported materials are divided into Osong plant and a Deso plant. And regarding biomaterials, it can be segmented into three different categories. First would be infectious disease, and next is cancer and oncology department. And these two areas are collecting different technologies. And since we started biologics business since 2010, we focused on infectious diseases even from then. And 4 materials are being tested, and one of them is now going through a clinical test. And another area I would like to talk about today, which is virus and viral vector, it is also going through a clinical test. And we also have many antiviral clinical studies, and we are discovering these as oncology treatments. And as a new growth engine, we are developing a cell therapy, gene therapy area, and we are going through the discovery stage to identify some of the materials utilizing different centers. And by doing this, we would like to make sure that a combination therapy research projects are being offered and provided. So, among all these projects that we are embarking on, I would like to focus on COVID-19 vaccine development status. Of course, we can't share every single data with you, but I'm going to make a summation for our audience today. As you all already have heard, a viral infection, let's say you are infected by a material, there are 3 different main reactions happening in human bodies. So, what you do is you first identify the material coming in, and then T cell reaction or other immuno reactions occur. And then what happens next is creating antibody for recovery. So that is why a vaccine utilizes MOA, and you basically educate your cells and your body mechanism so that when the virus actually comes into your body later, you can successfully react to it. So it's a pre-training, pre-processing mechanism. And in the case of COVID-19, as recommended by WHO, I think this current vaccine option is going to be successfully preventing other variants and mutations of COVID-19. And in order to increase the request and the reaction of T cell, we need various recombinant protein technologies to be adopted. And because previous speakers mentioned pipelines a lot, I'm going to skip this part. If you look at recombinant protein vaccine, I know that many of the materials are usually viral vector that are going through last phases of clinical studies. You might think that the development phase is much slower in this part. The reason why this is happening, the reason why recombinant protein vaccine is made slowly is because you have to take a lot of time in the initial phase. And once the pre or early stage clinical stages go smoothly, then the later part becomes expedited. Sorry, because I'm wearing a mask, maybe my sound is not so clear, so please understand this limitation. So now, when you use recombinant protein vaccine, you have to utilize specific antigen. When protein involves an infection, and you have to choose and select antigens that can effectively respond to those foreign materials. And for COVID-19, we use a lot of spike proteins, and you have to understand whether it's full representation or specific representation of spike protein. Depending on these options, you can come up with different options. And either you use viral vector or the total virus inactivation. There are many different patterns that you can use as antigen candidates. And as a result, usually immune booster, which is adjuvant, is necessary for this type of protein vaccine. And in terms of that, there are commercial adjuvants, and most well known will be Allen. And for the US, there is CP, Terra, Line A Boost. These are some options. And GSK is offering AS series through various formulation. And these adjuvants and antigens are going to be mixed and joined and combined, and then they will go to human bodies. And there are 2 expected reactions. One is humoral immune response, and also you can boost immunity of physical cells. And by doing so, the same immune reaction could be induced and encouraged. And in order to produce these vaccine lines, because you have to use a specific animal cell, the lab environment is quite tricky to manage. But because these are most commonly used and widely accepted and adopted measures worldwide, you can utilize existing facilities more than any other options. And also, as you add adjuvant formulation, you can also induce broader immune responses in human bodies. And because it only reacts to specific antigen, cost effectivity is relatively high too. So moving on to the next slide, for a recombinant vaccine platform, there are many different adjuvant combinations are offered to enhance T cell immune response. There is eventually our main goal is to increase T cell immune response, but there are many different lipid structure and pretty complicated structure is laid out, so this could serve as a disadvantage. So currently, if you only look at recombinant COVID-19 vaccines, you can see that aside from Novavax, they're not going through the later part of clinical phase because, as I said, initial stage takes a lot of time and effort. And for adjuvant, alum is most commonly used adjuvant. And because alum only specifically increased Th cell response, so WHO is not recommending this option. They are saying of TCHO cell responses to be induced. That is why there are some other commercial options as adjuvants. And what we have as our technology is that peptide lipid controlling mechanism. So, depending on the level of control, it helps the representation and also eventually increase the TH cell response. So, instead of using very complicated adjuvants, we can only use alum, and as a result, can cause two main immune responses. So let me skip on some parts. All in all, I would say the most representative would be Novavax, very similar to Novavax. If you look at represented antigen, you have to look whether it's fully represented, and if that is the case, you can formulate antigen that is successful. So I think our strength is that representation is quite easy, and when we tested on primitives, you can see the T cell response was relatively high, and you can see that central immune response was induced properly and adequately. And as I mentioned, CPP technology, cell penetrating peptides, is basically going into the cell, and you can see that technology increases the precision of attacking and targeting cells. And as a result, during the recovery, the activities became more vibrant, and thanks to the help of Alan and the other adjuvant, you can expedite and encourage the immune response. And as you know, there are many different variants, and following studies have been carried out. I think as of now, the most problematic would be South Africa. We haven't done human to iron, but for primitives, we can look at some of the studies being carried out. And for UK, it's basically the same antibody, same efficacy is secured. And for South African one, 10 times 3 efficacy was achieved. And I didn't put that data here, but because of CNI response, if you look at Indigo challenges report, there is a high survival protection rate also against South African variant too. So currently, what we do is we are planning a clinical stage 1, and we are planning one dose, two dose, and control group. And in order to go through an actual trial in Korea, we're prepping many different elements. And I know that Pfizer is out, and the efficacy of existing vaccines have been approved and showing how efficient they are. And we are going to continue to look at and refer to their results so that we can refine our vaccine development process. So, in summary, we can also tell you that we are providing and preparing technical clinical studies for other materials for co-development, and we will continue our research so that co-development can happen in the near future. This is everything from my side.
Thank you, Eun-ju Jung, Principal Researcher, Manager of the Biopharmaceutical Center of INON. We're also looking forward to seeing INON presenting new vaccines that will revolutionize a lot with their long history and their company mission of heal the world for a better life. Next, Korea Venture Investment Corp. Fund of Funds briefing will proceed. We'll bring Junyoung Park, Team Head, Growth Strategy Team, Korea Venture Investment Corp. Onto the stage, who will conduct the briefing session. Ladies and gentlemen, please welcome him with a round of applause.
Thank you. I'm Park Jun-hyung from Korea Venture Capital Investment. And today, it is a great honor for me to deliver my presentation here, so thank you. Today, I would like to cover this fund of funds and our health accounts funded by the government and how this investment is going on and what kind of achievements we have so far. First of all, we will take a look at the statistics of fund of funds. And if you visit our website, you will see this, and I'll briefly tell you what these numbers represent. First of all, if you take a look at the total fund size, then 4.1 billion US dollars. And this is the government subsidies. And so that translates into almost 7 trillion Korean won so far. And based on this fund, and we came up with 901 companies, and we have been covering foreign investors and those institute investors. And based on this full 901 funds, the number of the portfolio companies is tallied at 7,572. And so all the amount is 19.9 billion US dollars. And we received that investment, and we are currently delivering money to the market. And next, I'll briefly tell you about the business itself. And there are 10 ministries are currently providing funds to this fund of funds. And based on this, we have these resources to partnership with other government entities, and based on their policy needs, we can come up with different portfolios and make investment in other companies. And I'll move on to some details. And so far, there are some funds that we're currently operating. The statistics is the data from the first quarter of 2021, and this data is from December 2020. And the numbers differ a little bit, however, as I mentioned, through operating this fund, there are investments being made here. And based on this, and I just mentioned that there are 7,000 and This data was made last year, so the latest data shows that over 7,000 companies are working on this investment. And based on this investment, when the COVID-19 pandemic outbreak began, the government entities and we worried that there would be some tanked, nosedived investment. However, of course, yeah, that we did see some investment decrease. However, nowadays there are some investment in bio sector. So that actually the investment actually increased recently. So about 4.3 trillion in the Korean won investment was made, and that made a record investment. And this shows the amount that the Korean government made investment into the fund of funds. And despite the COVID-19 pandemic, this is showing this firm increase. And if you take a look at this LP, you can see how active different entities are in the market. And this data is from 2019, and there it shows KFOF, which means Korean Fund of Funds, and this accounts for 21% of the entire amount. And others, there are FIB and Korean Pension System and Korean Investment Bank and Growth Bank, among other investment entities and venture capital companies and other retail investors compose of this amount. And this composition itself is that while we are keep witnessing the increased growth of the amount, however, the percentage of KFOF is kind of decreasing because other retail investors are actively participating in the market. That is why. And as I has mentioned before, the fund of funds, the total amount is keep increasing, and accordingly, the amount invested in this fund is keep increasing as well. And I'm not sure if you will actually feel the difference. However, if you take a look at this, the percentage of investment compared to GDP ratio, it out exceeds that of China. And next, one of our prime goals is that we are planning to make unicorn companies to go public. And in terms of those unicorn companies, we account for this number, and it is keep increasing. And the number for those investment receiving companies are keep increasing. And I'll briefly mention some other companies, but you are familiar with other companies, but since this company works overseas, so you do not know. So here is an AI company, and more than 100 million people are using this HyperConnect application, and overseas users account for 99% of the entire users, and the sales reached 257.9 billion Korean won, and the total revenue is 24.7 billion won, and it went public on Nasdaq market, and it acquired at 1.9 trillion Korean won. And so this is our goal, like making those companies go public. And if you take a look at those companies that go public on KOSOK in 2011, in the future, we will see this increase, and 63.5% of companies received fund of funds investment, and those subsidiary investment received companies showed much faster growth compared to the opposite, and it shows much more investment and relatively short period of time. And in terms of fund of funds, I'll move on to the details. And the first goal of the government perspective and goal is job creation, and that is also our prime goal as well. And those companies that did not receive our investment and those companies that received our investment, the survival rate of the company differed. And of course, if a company receives fund, then it can survive longer. That is our common sense. However, those companies that received some debt and loaned, it showed a higher survival rate. And if you received investment, and it showed growth, and it shows that a meaningful sign that it does not act as an adverse result. And employment growth rate showed 32.5%. And in terms of biotech, it shows, this graph shows the differences. And there are many graphs are intertwined. But about a decade ago, when I said I'm going to invest in biopharmaceutical companies, other people said, no, you shouldn't. But recently, if someone says so, people says, oh, if you do not invest in biopharmaceutical companies, where else can you invest? So recently, if you take a look at this data, those companies that actually received investment, if you compare this data to the next one, if you compare the amount and performance, the bio industry shows much higher investment compared to other sectors. And in terms of Korea, Korea is a very strong IT company and software, so IT is also showing a lot of high performance, but biotech companies are also showing a lot of rapid increasing growth. And actually, this is another piece of data from our website, and it shows it compares the performance between 2020 and 2021. And in terms of growth rate, the ICT service and biotechs and retail service, if you compare these data, then you can see the significant growth. And also, this left chart is March 2020, and there on the right is March 2021. So all of you, ladies and gentlemen, here and all the Ministry of Health staff members, officers, I would like to deliver my appreciation again. And here, if you not take a look at this slide, not only did the amount of investment increased, but also our profit increased as well. If you take a look at this data, then let's say if I receive 20 billion Korean won, then you receive 300 billion won as a return. So this ratio was really higher compared to other sectors. And there are some other sectors that is suffering a lot of challenges. So compared to those sectors, bio sector is growing really well. And these companies, you definitely know these well, and I'll tell you what kind of investments in what specific companies that I make and what kind of growth I made. So, for example, LOK Bioscience and LOI and Research Institutes, a genomic company, and Tium Bio, among other companies. And I suppose that you are fully aware of these companies. And I mentioned in the beginning of my presentation that there are almost a dozen of government entities that are investing in this, and Ministry of Health is also hosting and supporting this investment. And there are 416 million, and there are currently ongoing funds and liquidified funds. If you take consideration, there are 460 billion Korean won in total. And if you consider those all-sourced funds and intra funds, then the total amount is slightly below 800 billion Korean won. And so far, there are some other drop funds, and if there are 5 different drop funds currently under investment, and there are 65 companies, and the total amount of 330 million Korean won being invested, and which is accumulatively 370 billion. And below here, it shows the liquidifying performance, and statistically, it is currently showing some significant results. And the numbers here are really high. If you are engaged in this industry, you will surely know that this is high. if you made this investment and got this result, then it is high performance, of course. And so clearly it is showing an excellent performance so far. And additionally, lastly, there was 1 trillion Korean won worth of investment in smart investment. Or, um, and during the post-corona pandemic, we are aiming this fund to further excel our goal. And this is not face-to-face Green New Deal. And so we cover these three different topics and make investment. And for this Korea fund, three government entities, including Ministry of Health, are making 1 billion Korean won of investment. And the key characteristics is that private sectors investors are acting as mentors to make investment here. And among those retail investments or those institute investors, Shinsegae Corporation and Krafton and Musinsa, among other 16 companies, are they're spending their investment into this fund. And from each different fields, fund managers are making investment in this fund of funds, venture capital. And when Park City, who was a previous professional golf player, who made Korea famous and also made investment here that gained a lot of attention from other Korean citizens. So through this fund, we're keep working on these sectors, including biotechnology, and we're continuously making investment in these different sectors.
그래서 저희 오늘 그 바이오 코리아에서도 하고 저희 보건복지부식에서
So for today's BioKorea Invest Fair, Ministry of Health and Welfare and Ministry of SMEs and Startups are putting utmost efforts to make this success. And despite this COVID-19 pandemic, various bio venture capital companies are in close cooperation with Ministry of Health and Ministry of SMEs and Startups. They will further keep their working on their efforts. Thank you.
Thank you, Junyoung Park. Team Head Growth Strategy Team Korea Venture Investment Corp. To support market-friendly venture ecosystem, they have been promoted participation of investors in venture investment funds. So thank you once again for the support of Korea Venture Investment Corp. So far on the topic of development of domestic COVID-19 vaccine therapy and strategies for global advancement as session 1. We have listened to the topic presentation and discussion and company presentation, and lastly, the funds of funds briefing session, which was beneficial for the companies seeking to enter the global market. So from now on, we will have a short break, and the session 2 will continue from 3:50. So the online participants will also take a break for a moment, and then let's meet again in session 2 at 3:50. We'll be back soon. Thank you. 네, 이제 행사가 시작이 되겠습니다. 세션 2
Now we're
잠시
about to
후부터
begin the
함께
next
하실 텐데요.
session.
이제 자리에
So
착석해
I would like
주시기
to ask
바랍니다.
all the audience to come into the venue and be seated. Thank you.
Welcome back. Did you all have a good rest? Session 2 will proceed with the topic of R&D strategy of in vitro diagnostic devices and kit for COVID-19. So that will be the topic presentation for session 2 first. We will have a Min Kim, professor and CEO, Korea Medical Device Development Fund, on the stage, who will give a presentation with the topic of R&D strategy of in vitro diagnostic devices and kit for COVID-19. So please welcome him with a round of applause. 큰 박수로 환영해 주십시오.
Thank you for the introduction, and I was asked to speak in English. And it's been a while since I've presented anything in English, but I'll try my best. Okay. So I'm a professor of biomedical engineering department of Korea University, and I'm a CEO of Korea Medical Devices Development Fund. So we are actually investing 1.2 trillion Korean wons actually to boost up the Korean medical devices industry. And from the perspective of technology, I'm not an expert of these issues like IVD devices and kits, but from a strategic point of view, I can probably provide something useful to you. Okay. So my talk is composed of three categories. I'm going to briefly introduce my institute, the Korean Medical Devices Development Fund, KMDF. And I'm going to talk about some of the IVD-related researches which is being supported by us. There are about 15, and I'm going to be talking about probably some of them. And finally, I'm going to be talking about commercialization strategy that KMDF is building up right now. So here's the overview. So here's our vision. We want to build a nationwide platform for sustainable medical devices research. So we are building a full cycle support system all the way from technology development to market entry. And our objective is to enhance, expand our market share, both in domestic markets and industrial in the international markets. So as I just mentioned, we have about 1.2 trillion Korean wons. Over 6 years, we are supporting so far, in 2020 only, we have selected 337 projects. And there are all kinds of projects, not only just IVD, but there are all kinds of conventional or futuristic devices we are investing. KMDF is being funded by 4 different government agencies, government ministries, Ministry of Science and ICT, and Ministry of Trades, and I can't see it very well, Industry and Energy, Ministry of Health and Welfare, and Ministry of Food and Drug Safety. There are 5 different categories in large and that we are supporting right now. So basically, our strategy is, and before it was there was insufficient and duplicate supports for R&D, research and development in medical devices field, and they have been supported by different ministries. We are trying to build a consistent support centered on KMDF. And there has been some criticism that says that there was segmented and partial support. And especially, on the later stage of the commercialization, there were not enough support from the government. We are trying to fill that gap. Okay, and there has been criticism also about the regulation issues. We are actually collaborating with the regulatory agencies of the government, and we are building up some ways to ease down the difficulties or go around, specific problems. As I have just mentioned, there are 4 government ministries which are supporting us, and here's our KMDF organization. We have board of directors and operating committee, and also government funding agencies like NSF or KATE or KAIDI is actually working with us, trying to gather our elaborative efforts. We have 3 teams: management team and R&D support team, and commercialization strategy team. Okay, so I have brought up projects, 5 different project categories which has been supported by us. There are actually 2 more, but they are individual projects. So there are 5 large categories. First is categories for global competitiveness. So that in that category there are a lot of projects which builds the medical devices which already have some competitiveness in the market, and we are trying to make premium devices, premium products. And also there are lots of medical devices which causes a lot of trade deficit. Okay, we import a lot, but not much of export. But there are industries. The industry is not strong enough, and we are trying to boost up their capabilities to international levels. The second category is for market-leading technologies. So we are building devices, futuristic devices, which is targeted to meet the fourth industry revolutions. That category includes some robots and some AI or machine learning related stuff, and also some futuristic materials, biomedical devices materials. Third category is for solving social healthcare issues. We are building medical devices for elderly people and also disabled, and also socially some other patients, which is locally very far from the medical agencies. The fifth one is the infectious disease. I'm sorry. We're trying to strengthen the national defense systems against the infectious diseases such as COVID-19. Okay, so there are a lot of IVD related projects in the first category and the fifth category. Okay, this is the structure of our projects, and I have broken it down to 9 different TRLs, technology readiness levels. So very early stage of the research is technology, TRL 1. If you mass production is in TRL 9. So our projects mostly starts at TRL 4 and or 6, and they end up at 8, which means we are targeting to actual commercialization of these products. Also, there are projects which is building some basic technologies which can be converted to future medical devices. The major principle of our structure is that we are following the National R&D Innovation Act, which is started to be active this year, and we actually reinforced the evaluation systems, and we are trying to maximize the performance, which is actually a commercialization. So, well, technically, I'm not an expert in IVD devices, as I said, but I'm going to try to explain, what kind of new technologies are being constructed, being supported by us, which is related to COVID-19. So you probably are very familiar with this chart in here. This is the status of IVD global market. And the 2020 global market is estimated to be $83 billion US dollars. And it is expected it's going to be growing up to like 4.5 annually, which is going to be reaching up to $113 billion in 2027. Okay, mostly, the global market is, mostly focused on immunoassay issues, 32%, and hematology molecules. I can't see very well, and others. Okay. So here's the domestic market status of IVD. As I said, this is a statistics that has been built in 2019. So they do not include what happened actually last year. Last year was a year there was a huge change, as you all know. There was a pandemic situation, which actually made there was a major game changer. And domestically, it is estimated that the annual growth rate is going to be up to 2.9%. And in Korea, and from 2019, and our strength was in molecular diagnosis, and second was immunochemistry. So basically, they have matched the needs of last year's, and that probably is why we were pretty strong last year, and which built the name of K-방역, I think. And here's a list of major players, Bioneers and Seagen, and many other companies and academic institutes. Of course, the last year was kind of historic year from the medical devices industry because there was a transition from trade deficit of about $450 million to surplus of $510 million last year, mostly because of this of your effort of COVID-19 situations and pandemic situation actually built these kind of changes. And there was in the first medical devices company in Korea which sales extending 1 trillion Korean won, and that was the first also. We have support of many IVD related devices in our research, and among them there are about 15 COVID-19 related researches. And among them, there are 8 devices research, and IVD kit 5, and materials 2. And some of them are focused on molecular diagnostics, and some are immunological diagnostics and POCT. And the figures that I'm going to be showing right now has not been brought from the actual proposal of their proposal because of the intellectual property issues. So, I mean, we just, collected, the right figures, probably matches well with their intention from already published data. So the first thing that I want to show is that there was a all-in-one isothermal PCR using a LAMP. LAMP is a loop-mediated isothermal amplification PCR, which is new technology. So what they're trying to build is an all-in-one PCR. So here's a conventional diagnostic method. There was a harvest and nucleic acid extractions, amplification, and detection. And they're trying to put all these 3 stages together into one stage. So this is one of the researches we are supporting right now. And also digital photonic PCR, which is quite new, I think. So this uses a plasmonic phenomena. So for nanowells, there are nanoparticles, nanostructures in there, and the PCR material is going to be illuminated by light. There's going to be rapid heating and cooling procedures, which does a pretty rapid PCR. So this is also being built. And there's also automated immune diagnosis platforms. And the top picture is just a regular immune diagnostic platform in there. They're trying to build a system which can read all these results rapidly, and they use full automation and barcode identification and liquid level detection and high throughput diagnosis. And also, there are several groups. I mean, I know that there are already a company which have built this kind of systems. So they are trying to build a system which can do the diagnosis on not only just the COVID-19, but the influenza also. So not only just in influenza, and there are a couple of more viruses that can be detected using this system. Okay, the next one is a development of NGS. NGS stands for Next Generation Sequencing Based Molecular Diagnosis. what this device does is that by using some kind of informatic analysis and AI technologies, they are trying to detect the mutants. And there are several materials research for IVD, like a high affinity nitrocellulose membranes and nanowells and channels, and new swab and wipes for sample collections. Okay, and the final issue is that, so what the KMDF is doing to facilitate the commercialization process. So here are some of our strategies. I can't explain the details of these. I'm just going to give you a brief ideas, bulk ideas. What kind of efforts we are doing right now. Okay, as you all know, from the R&D stage to all the way to commercialization, there are lots of stakeholders. Okay, there are lots of agencies and stakeholders that have to be involved to finally put something into market. Okay, there are licensing, regulatory agencies, and medical devices clusters like Osong and Daegu, and government agencies we are collaborating with, and medical institutions, and enterprises. And we are trying to various kinds of advisory systems like clinical, technology, investment, market, and IP and support. So I have listed the kind of programs that we have established to help out this industry from low TRLs to commercializations. From the clinical point of view, we are actually collaborating with a lot of medical institutions, trying to put their inputs into actual products. And the patents, we are actually imposing the system that the patent issue has to be checked first for each individual project, because there are lots of projects that end up failing because of these patent issues. So, and also we are working with Osong and Daegu and trying to help to build the prototypes. The regulatory agencies, we actually built in MOUs, each one of these agencies, and we are working closely together, trying to improve our communications with the industry. And our KMDF has a lot of experts which can help targeting the markets or defining the markets, not only just domestic market, but international markets also. So, I have been talking about KMDF's effort. There are also a lot of programs that has been proposed and actually executed by KAIDI. Okay, there's an ID support programs by KAIDI, and the first thing is that the rapid acquisition of export licenses. There are about 23 products that actually received the export licensing by collaboration with KAIDI. And also, for a lot of samples in the emergency time, they actually introduced a lot of medical institutions to collect, the right samples for preclinical data. And also, not only just us, they are also investing some funds to raise the new technologies. I think it is really, really important that the government, as I said, there are a lot of stakeholders in terms of commercialization of medical devices, not only just IVDs. And we are actually trying to build a lot of communication routes. Let me just tell you that June 16th, which is next week, we're going to have comprehensive R&D conference in L Tower. And also we have a lot of, not only just the movies and YouTubes, or we use a lot of media actually to advertise, what kind of efforts we are putting to help them out. And we are, talking with, VCs and companies. And if there are some issues, regulatory issues, we are meeting with them and trying to collect their data, their ideas, and bring it to the right government agencies. Okay, that's what I have prepared for today. Thank you for listening.
Thank you. So it was a presentation by Professor Kim, and he has talked about the topic of session 2 under the theme of R&D strategy of in vitro diagnostic devices and kit for COVID-19. Now we'd like to proceed with the discussion. So as debaters, I would like to invite Min Kim, Professor CEO, Korea Medical Device Development Fund, and Hyun Nam, CEO of iSense, and Dr. Hanu Park, President and CEO, Pioneer Corporation, onto the stage. So we have three panelists on the stage now. Once we are ready for the discussion session, then you can begin the session. Right? Seems like, yeah. Yes, of course. That's your choice. So we have prepared a perfect interpretation service, so you can choose.
All right, I'll speak in English. That's Korean. Excuse me. So it was a great honor for me to know what KFDA actually is working on and the fund, how the 1 trillion USD fund is being used in detail. And thanks to you, I had a good understanding of what is going on. And in terms of global competitive market and strategy and approving strategies, among other issues, and how that is allocated and distributed. And it was highly helpful. And the procedures and how they were selected, if that kind of data was included and if you provide that as well in the future, then that will be informative too. And in the market, if you introduce those market players in our market, and if you provide that data so others can refer to, then it will be very helpful and for others to get information about that as well. So overall, the KMDF's information data and how the organization has been working on contributing this industry. So thank you very much for your presentation. Thank you. First of all, I expect to get some questions from you, and I'll just probably talk about the market. And we do have some significant information, and if you do want some specific information, if you contact me, then I can provide you. So, well then, I would like to ask one question about the market. And last year, when the COVID-19, when it began the outbreak, we, under the theme of K-Bio, we also named K-Quarantine, and many people were excited about this hype. And as you have shown from your presentation, we used to import goods, and now we changed it to a surplus. And I myself, being an industry player, if I took a look in this data, there were some limited number of companies, so I wouldn't say that if the industry itself is well activated to say that we are actually activating this K quarantine or K vaccine. So from the government level, if we take a step aside from being excited about this all hype, and we have to think back why we were so excited about this, and actually a countless number of companies jumped into this market. However, ultimately, you can see Seagen or other unnamed companies from the presentation. Some companies made some trillions of dollars of profit, but meanwhile, other companies put a lot of efforts, but just made some trillion billion Korean won, or even they lost their money. So there were some winners take all. So as a personal discussion participant, I would like to urge some interest or participation from the government is that, or some other outsourcing ideas is that how they began and how they worked on this and how they made this kind of success, and in other fields why those other companies failed in this market. If you come up with that kind of analyzing data, then if we face another possible pandemic in the future, how we are going to take countermeasures and how we are going to take this challenge into an opportunity, that kind of idea. So if you take a look at this R&D research data, then it is highly focused on this R&D. However, if you cover those marketing parts, and if you think back of the past, then if you provide that kind of source of data, then it will be highly informative.
Should I go ahead first? Yes, I think that was a great comment and idea because there are some successful cases, and as you know, there are a number of failed cases as well. But what is more important is whether it's sustainable. We do not know how the pandemic will change its trajectory, but let's say, let's say there's a brand, you don't even know what is going to happen to the brand. So, as CEO Nam mentioned, I think we have to understand why a certain project or brand failed, or why, if it succeeded, had succeeded. It's not like I'm representing the government or anything, but as one of the funding agencies, I talked to many different stakeholders, including medical device related to the device industry, and this is definitely a great moment for us to look back and review what went well and what needs to be improved, what is our strength and what is our gap that we have to fill, so that for strength we have to develop them further, and then if there's anything lacking, we need to fill that gap as well. So we are going to take the leadership in this project. Thank you.
Thank you.
그 추가적으로 저도 그 부분에 대해서 좀
And I have an additional thing to say about that issue.
성공했던 기업들하고
So for those companies that made a success and for those companies that made a failure,
기존의
and the key difference between the two is that the conventional diagnostic medical kit market is highly conservative, and those companies that recognize this position and if they have a supply chain or not. And for this diagnostic kit, if for those companies who have previously distributed their medical kit, there were cases where you have to use those medical equipment to work on it. So for those companies that had not have any medical equipment in the past, then they had a lot of challenges. And CGen is a company that made a success in this part because CGen has distributed a lot of medical equipment and nationwide. And for among other global companies, they based on the previous conventional platform, they increased their sales significantly. So and also my Bionia company also itself also had a lot of market penetration in terms of medical equipment. So thanks to that platform, we could make a lot of sales. And for medical kit, there was some medical equipment shortage last year because in the United States there was some export prohibit. So when that happened, when we were a provider for a third medical kit, and we provided 1,100 folds of additional supply, and we were keep making sales. And last year, in vitro market, if you take a look at the market, and as you mentioned before, if you take a look at the entire market, it slightly exceeds $80 million. And last year, the COVID market is projected to become about 119 billion US dollars or so. And how this COVID-19 market, vaccine market, will be like. Because of potential variants, the market will keep ongoing and activated. And there are some opinions that this market will shrink in the years to come.
혹시 이제 공급처
And if, as you, head of Korea Medical Device Development Fund, what is your personal opinion regarding this issue?
Well, that was a very tricky question you just asked. I think I can maybe give an overview and then go into detail. From my understanding, there is expertise that we have accumulated and that we possessed, but I think there are many different researchers and companies with different technologies and capabilities, and we continue to communicate with them. We get information and data from them, and we also hear news, and we're basically a media and a hub of transacting and exchanging that data and knowledge. And when I think there are companies that were suitable and got lucky when it comes to timing and timeline. And as you mentioned, what matters is how you can better utilize a supply chain that you have developed. And because there was some learning factor from SARS, there were some early movers who prepared themselves quicker than anyone else. And I think Act Fast is really, really important going forward. And maybe going back to your question next, you are asking whether this is going to continue to grow or the size of the market is going to be maintained. But it's really tricky to predict what's going to happen because of a vaccination, we are finding a solution, sort of. But then, if you think about all the results and achievements that we have made, they have to be converted to the medical system, and this is actually burdening the medical system and infrastructure. So whether it's sustainable, I'm not so sure. I think it'll be very difficult because in the past, like last year, for example, it was a national emergency. So the government was providing support in order to successfully tackle this contingency. But now without this, we will have to basically be on our own and then manage the issue. So it'll be difficult. And just by looking at COVID-19, I think the market itself is going to shrink because, like, we do not know how much control we're going to have about mutation or variants. So it's still up in the air. But if you only look at the COVID-19 market, it's going to shrink. And one thing I would like to say at this occasion is not just the diagnosis market, but pandemic is already has been penetrated into our lifestyle, daily lives. So I think relevant markets could grow in the future. For example, indoor or outdoor. For example, air-related issues or filtering issues, ventilation issues, or other home appliances. If you think about them, whether these appliances are going to tackle COVID-19 or any other infectious diseases, these market needs could be expanded, and then maybe you can think out of the box.
I'm not sure how many minutes we have until the end of this discussion session. Like, how many minutes do we have? Oh, 7 minutes. So, as you said, CEO Park, the previously widespread medical equipment and those conventional players could take advantage of it, but those new participants had a lot of challenges. So, and despite that, meanwhile, the entire nation was highly excited about this K vaccine issue, and many companies became late participants, and that is because the IVD market's overall characteristics were not fully understood by those companies, I personally think. So, and between companies and companies, it is totally impossible for those companies to share their information with each other. Because if you take a look at those Korean newspapers and news media outlets, that some companies received the EUA from the stage, and they came up with a lot of index. But some companies, instead of getting the EUA, they went to the WHO and got approval from the organization and distributed their supply chain to other places. So if you take a close look at all the background information and like this, and if companies fail to share their information, then there will be some winners and losers. And the more those companies that appear in the Korean market, that is good for us as a national level. And the characteristics of IBD market where it is difficult for companies to share their own information and how we're going to working on the clinical trials and how we're going to access this market and this kind of data probably at some point we do need this kind of information sharing, and if we come up with this kind of significant data where other companies and entities can refer to, then this will contribute to the development of this. For example, for FO2, they do have the same conventional medical kit, but those based on the tests, they take their photo of this and they share this to the airline company. And when you go to the airline company, then the previously medical kit data can be synchronized with the vaccination or the medical test. So if you make use of it, then we can make meaningful results. And nowadays, many companies are just busy looking for distributing measures. And I have never seen a case where there was an interaction cases with Carl. And if there were any cases where a company or an entity can make up with a small diagnostic kit at the international airport. If we open a room for this kind of thing to happen, then it will be of a lot of help.
I'm not sure I'm the right person to answer this question, but when our institute was created, I think one of the core principle or issues were included in your previous comment. Let's say there is a new idea or there is a new market entrance that's necessary. Where do you start? I think that is an important point because there is a lot of infrastructure and including government agencies pre-existing. However, the reason why we decided to choose a location in Seoul station was because we want it to be accessible by everyone. Whenever there's a new idea, and if you want to maybe start a discussion with stakeholders, I want those candidates to come to us so that we can provide help and support for the development of the ideas. But I think what you mentioned is maybe larger or bigger than what I just mentioned. The government can create some rules and routes, but I don't think that is very familiarized by stakeholders and participants. But maybe the pandemic has shifted this pre-notion. So if you're going to plan anything, then maybe things will be different in the future. We will also work hard.
Thank you. And I think this will be the last question for this session. And after the outbreak of COVID-19, the molecule diagnostic kit is widely used in the world, and in Korea, we successfully made use of this to preemptively find COVID-19 patients who contracted the virus. And the molecule-based diagnostic kits typically takes 4 hours, or if you have to be at a specific place, and there are some limitations. And in order to overcome those challenges, we need next-generation technology, I personally think. And the Korea Medical Device Development Fund, what kind of vision do you have, and what kind of medical equipments do you think there should be developed? Well, I'll just talk about this briefly. And there are some macro and broad projects currently working on. The molecule diagnostic kit is the standard, and in order to speed up developing this, there are some various ideas, and we are supporting those projects. And I personally think that we do need this kind of efforts, and there are amplifying technologies, or if we come up with new primers among other efforts. So we're supporting those kind of new technologies, and in order to introduce those technologies to the market as soon as possible, that is also important. But if it is also important to make the conventional medical device and kits more strong. There were a lot of developments in the diagnostic kit industry. However, if you ask a question if the fundamentals of those grew as well, then I'm not quite sure, because the preemptive or previous medical kit technologies, you have to take parallel measures to develop those industries as well. And continuously, we will put efforts to identify and develop new technologies. And we are currently planning on identifying and developing new technologies. And if there are good people with good ideas or opinions, and then if you come up with me and share your ideas, and I will highly appreciate it.
All right. Thank you very much for the discussion session. And also, you may step down from the stage. Please give them another round of applause for their enthusiastic discussion. Right, it was a very meaningful time for us to discuss how in vitro diagnostic devices and kit for COVID-19 should be researched and developed in order to overcome COVID-19. Thank you to all the panelists for their in-depth discussion. Next, there will be a presentation by Guk-jin Lim, CEO of Proteum Tech. I will bring CEO Guk-jin Lim to the stage. Please welcome him with a round of applause.
Hello. Hello, everybody. This is very honor for me to be invited to BioKorea 2021 Investment Fair. I'm Guk-jin Lim, President of Proteum Tech. Now I will introduce our company, Proteum Tech's activity against COVID-19. Protect yourself from the serious infection is a highly specific COVID diagnostic kit and human health monitoring kit. Till today, sorry. There's 173 million people suffered from COVID-19, and 3.7 million people have already died, and 10,000 people dying every day. Recently, the several vaccine has been developed and urgently vaccinated. Now about 15%, 20 dose means the 2 billion dose means the 15 population were vaccinated now worldwide. So we are hoping that severity of COVID-19 will be reduced. Our company, Proteum Tech, has developed the 4 kinds of diagnostic product to prevent COVID-19 pandemic. To check the viral RNA, Xenodia product were developed. To check the viral antigen, COVID check. And checking the virus-specific antibody, we have the COVID check IgG and IgM. And another one, to check the individual immune health monitoring, we have COVID check IgG was developed. We have supplied two products to monitor RNA molecular diagnostic kit. One is the COVID-19 virus only, and another one is COVID-19 and the flu influenza together. Genedia COVID-19 qRT-PCR is the one-step real-time RT-PCR assay kit intended for the qualitative detection of nucleic acid from SARS-CoV-2. It composes of 4-tube enzyme mix and the primer mix and positive control and negative control. It's very simple designed. And it targets one gene and N gene and E gene of COVID virus. Genedia COVID-19 RT-PCR kit has the merit of efficacy and the great accuracy. It used 5 microliter of RNA. A sample prep can detect 10 copies of SARS-CoV-2 gene. In clinical evaluation, Genedia COVID-19 qRT-PCR shows 100 sensitivity and 100 specificity, and perfectly satisfied FDA and KFDA's criteria. We have another COVID-19 molecular diagnostic kit can detect flu and also COVID-19 together. As you know, COVID-19 and influenza shares the common symptom, fever and cough, and shortness, breath, and body ache. But the treatment, we already have the drug for the influenza, but we didn't have COVID-19. So we need the influenza and SARS-CoV-2 combo kit for etiologic agent. COVID, Genedia, SARS-CoV-2, and flu A, flu B, fast artificial kit is one-step real-time artificial kit for detection nucleic acid from SARS-CoV-2, influenza A, and influenza B together. It targets WRF1 gene and E gene for SARS virus, and M gene for influenza A, and E gene, HA gene for influenza B. All genes were amplified simultaneously in one tube and give the accurate result to come out less than 1 hour. Genedia SARS-CoV-2 flu A, flu B fast qRT-PCR kit composed also of 4 tube, and enzyme mix, a prime mix, positive and negative control. It is very sensitive. It can detect few copies of a virus. Genedia, in clinical evaluation, Genedia SARS-CoV-2 flu A, flu B fast qRT-PCR kit shows 100 sensitivity and 100 of specificity for the 3 virus, and also perfectly satisfy the criteria. Another kit, COVID-19 IgM diagnostic kit, we developed. COVID-Check, COVID-19 IgM is the retroflow antibody immunoassay kit intended for the qualitative analysis of SARS-CoV-2 spike protein, specific immunoglobulin G, immunoglobulin M, in human serum, plasma sample, and even in whole blood. COVID-Check, COVID-19 IgG and IgM kit is a POC test, and therefore it needs no initial cost. It does not need the machine, and takes a few minutes, 15 minutes, and multiple suspected patients can be inspected at once. It can determine the history of infection, now the vaccination also. So many people can be used the antibody response after vaccination. Our COVID-19 IgG IgM kit has separated whole for blood sample and development buffer. Clinical performance in Dongsan Hospital and Daegu shows wonderful efficacy, 96% of sensitivity and 98% of specificity. Overall agreement to PCR result is about 98%. 15 minutes after dropping sample, specific IgM and IgG will be appeared COVID-19 patient. COVID-Check, COVID-19 IgG and IgM kit can be useful for immune response monitoring too after vaccination. COVID-19 antigen diagnostic kit. We developed COVID-Check COVID-19 antigen kit. So it's detect the coronavirus nuclear capsid protein in human nasopharyngeal. It can detect 200 TCID of infected virus and nanogram of nuclear protein of COVID-19. And there is no cross-reactivity against other seasonal coronavirus. And another kit is the immune health monitoring kit, POCT kit. Immune check, IgG, can check the concentration IgG in the body. It uses only 5 microliter of blood. After 20 minutes, you can read your immune level. So if you find the IgG level is too low, you should go to the doctor and try to improve your immune system. For the company overview, Protemtech was founded in 2000. Proteomics technology based on the research-oriented company. To find the biomarker to therapeutic target of diagnostic kit in 2014. Allergy multiplex diagnostic kit was launched, and now several dozen of in vitro diagnostic medical device on the market, including COVID-19. Our main product is allergy diagnostic kit, our Protea Allergy Q. It has very strong point of multiplicity for the patent. And compared to other foreign diagnostic kit, it is 3 times more allergy on the test. So this kit was launched in 2014. The market share is increased rapidly in Korea, now about 45 domestic market share. Another kit is the food IgG, and another kit is TreeCheck. TreeCheck is the novel pregnancy test composed of 3 lines of overcome the false negative problem in high concentration of HCG. All pregnancy tests have 2 lines, have the technical issue of hook effect. TreeCheck is the only one that is free from false negative issue come from hook effect.
So CEO Lim, I'm very sorry to interrupt you, but since we have a time limit, so I really appreciate it if you do the closing comments.
Yeah.
Thank you.
So we have many different kinds of patented technology. So all this one is including patent developed. So we want to be a reliable business partner. Thank you.
Thank you very much. And once again, we'd like to thank CEO Kook Jin Lim for his enthusiastic presentation. And I'd like to ask for your continued interest in this company, which will grow further with improved performance by commercializing products with excellent business feasibility. All right, then move on to the next company presentation. And now there will be presentation by Eugene Seo, CEO of Jin System. We'll bring CEO Eugene Seo onto the stage. Please welcome him with a round of applause.
Good afternoon. I'm Seo Eugene, CEO of Gene System. And I would like to, first of all, deliver my appreciation to you all. And today, here, before I introduce my company, I would like to define what my company is and then move on to introduction. First of all, is that the real-time offline molecule diagnostic kit platform is our keyword. And representative of this platform, we guide you to figure out your information about in vitro. And the immunoanalysis, there are strengths and weaknesses in both in vitro and in vivo diagnostic. And currently we're experiencing this COVID-19 pandemic. And there are some keywords that we should take a look again. The fast, timely diagnostic results and accuracy and convenience is the key. And there needs a platform where it combines only the strengths. And today here, I would like to introduce you Gene System and how we're different from other companies and how we're different from other in vitro medical kits and what kind of key perspectives, characteristics we have, and the technology that we have. And the key idea that we were in a dire need and how close we are to the keywords. I would like to let you think if this is really needed or not. And first of all, this molecule process, if you take a look at the below, we um, halved the process of diagnosis, and we only take 30 minutes while other medical kits take 90 minutes. So we significantly decreased the diagnostic time. So you may think there is not so much difference besides time, but our platform, I would like to mention a capsule coffee reference. The conventional coffee, if you wanted to drink some coffee, you had to go to a cafe and a barista analyzes the coffee you want and grinds the coffee and drips the coffee so you could enjoy a tasty coffee. But nowadays, it's different. Consumers can just buy a capsule coffee device and just they can input the capsule and you can enjoy the scent and taste of coffee that previously were served by a barista. So a gene system, it's just like the coffee market. It's just like consumers enjoying that capsule coffee. Gene Systems platform, we can bring this conventional medical kit where you had to be offline to go through conventional diagnosis. You can just be at home and diagnose yourself. And this kind of molecule diagnostic platform, just like you can enjoy various kinds of coffee from the device, you can conduct various tests, and not only the target. If you bring a diagnostic target from other companies, you can also conduct a test. So I am sure that our entrance to the market will be very fast. And our innovative platform here is more than the conventional one, and we are expanding to a multi-platform. And the multiplex here refers to, as you know, is a platform where you can diagnose various characteristics at the same time. And this you can conduct a one-time it fits all diagnosis to figure out all the results of similar symptoms. Just for example, when you have fever, if you cough, in the past you had to think, maybe it's just fever, it's cold. But nowadays you have to think, is it COVID, coronavirus? So you never know if it's a cold or COVID. So you have to be quite sure what kind of a disease you currently have, and then you can move on to treating it. And last week, we came up with a simultaneous diagnostic kit for 5 different breath-related disease, and we got approval. And the market that we are currently engaging in is showing 12.6% of a market increase in terms of CAGR. So we are showing a rapid growth compared to other markets, other sectors. And if you take a look at the market potential, then those advanced markets, including the United States and the European market, we do have characteristics to advance to those advanced markets, and we are something more than the conventional multi-platform, and you can diagnose, go through, conduct 50 different tests at the same time simultaneously thanks to this device. So we are preparing to expand to the European and the American market. And like I mentioned before, this kind of expression device and technology, and I will move on to the details of the key ideas of here. And first is this hardware technology. This technology is something that you can take speedy and timely diagnosis. And in the conventional PCR technology was very thick, and no matter how fast you wanted to do, physically, there was some limitations, so it was almost impossible. However, our Gene Systems PCR technology, you make use of this biochip to make a PCR chip. It is just a size equal to two 101 coins combined. So this small chip can deliver the temperature very quick, so it can test the temperature really quick. And we do not use the conventional thermotype, and we use this most camera so that the fluoroid image we capture the image and we analyze that captured image, and we go make use of that analyzed data. So this kind of technology that we have is both competitive in terms of price and speed. And based on this technology, we received a presidential prize back in 2013 at the Invention and Innovation Convention. And this is highly adequate, well suitable for this PCR analysis. And we can, in the past, we were able to go through a 10 to 15 diagnosis, but however, we need more than that nowadays because of COVID, and so we made this into one simple molecule, and this each part reacts and they can use as a primer for each different types. And thanks to this technology, those typical primer reacts to this each different particles, and we move away from the limitations and we can detect these fluorides colors. And thanks to one single color, we can detect almost 50 or so, and we're currently preparing for 50, but we think we project that we'll be able to detect 100 or so different types, and we make use of this primer to bring this to life. This realizing this primer and working on this is a very significant one, and another significant technology is that each particle here reacts to different, and those fluoride solutions are all mixed up, and there are some potentials that they will all mixed up, but we prevent that. That is another strength. So our primer multiplex technology can analyze many different types at the same time. And the third one is biochip technology. This technology, as I mentioned before, I used the coffee capsule reference in order to analyze molecules and the agents that is included in this, and all those procedures are embedded in this. And because it is embedded in this procedure, if you just insert this sample, then you can go through diagnosis. And also, this technology, you can just store this in the room temperature. So you don't have to put it into a refrigerator or a fridge. So this is really suitable for on-spot, face-to-face diagnosis. And currently, the COVID-19 pandemic medical kit, we make use of this technology to commercialize our goods. And this each device has the primer kit. So for those places where those underdeveloped countries or continents, including Africa or Southeast Asia, where they lack this kind of medical equipment or technology, we are conducting medical equipment and diagnosis in those areas. So I just mentioned three characteristics and our vision, and based on that, we collaborate with conventional molecular diagnosis and the our Biomedios molecule technology. And if we compare our technology to other companies, including the company that I just mentioned before, I am quite sure that we are competitive enough. And this technology I mentioned, as I mentioned in the early part of my presentation, the three key ideas: quick, convenient, and accurate. And convenience. These three key ideas are very suitable for nowadays demand. And based on this technology, not only will we cover the human body's diseases, but also we will expand to food safety market and pet industry, among others. We are currently working on expanding to other sectors as well. And based on the data we acquired, we by 2025 we will reach 110 billion Korean won of sales. Thank you.
Thank you, CEO Yoo Jin-seo, for his wonderful presentation. We just have had a company briefing session with Gene System, which is working hard to diversify new products for the post-corona era. So last but not least, we have only one presentation left. So it will be a presentation by Dr. Hano Park, President and CEO of Pioneer Corporation. So we have the CEO Hano Park on the stage. So please welcome him with a round of applause.
Thank you for inviting me in Invest Fair 2021. I'm the CEO and founder of Pioneer Corporation. This is a safe harboring statement. And I will talk about the company overview and COVID-19 say, and our growth potential and financial highlight for the investor. The company is founded in 1992 as the first biotech with PCR technology and oligonucleotide synthesis, two major pillars of our growth. And we have now the credit rate B. I hate B. I like A. But I hope in the near future we can be A. And our current shareholder, I'm the still major shareholder and institutional shareholder, and 68% is the individual. This is a brief history of our company. At the foundation, we commercialized the PCR enzyme and oligonucleotide. And in year 2001, we developed the first real-time PCR for the bioterror protection for Korea Japan World Cup. This is the first Asian real-time PCR. And in the year 2003, the SARS pandemic, we supplied the PCR reagent to the Chinese CDC. After then, the new influenza pandemic in year 2009, we developed the swine flu diagnostic kit faster than Russia 2 months earlier, and then we supplied more than 2 million tests to the Korean healthcare facility. After that, we developed all the new pathogen diagnostic kit, including Ebola, Zika, and MERS, and COVID. And we also developed the viral load test kit for HIV, HBV, HCV, and resters in C. This is the unique Asian company who have the risk to A, the viral load test kit, and we are now listed in Global Fund for this viral load test kit. Our business model is based on the disease prevention and diagnostic and therapeutics. We have two subsidiary company, Ace Biome for the probiotics for anti-obesity, and therapeutics company based on the RNAi technology. We have Sonagen Therapeutics, which have a very promising pipeline. And we have our main cash cow is the molecular diagnostic, and we supply the existation from the start of the COVID-19 pandemic up to now. We provide more than 1,100 units to the world. Our systems has some advantage from the small lab to large lab based on the daily test number. We can provide, we can customize our system for low throughput to high throughput. I'm sorry. We have developed the raw material for molecular diagnostics. So we now have the ton scale phosphamidite production capacity, And daily, 30,000 oligonucleotides can be synthesized in our facility. And we also have the 100 million the polymerase, the production capacity. And we also developed our novel nano-magnetic silica bead, which have the 100 kilogram production scale. This is integrated in the kit and run on our novel instrument. So we are one of a few companies developed all the raw material and molecular diagnostic kit and the system. So we warranted the total quality warranty is our big competitive edge. This is our IP portfolio in the molecular diagnostic kit and nucleic acid extraction and molecular diagnostic instrument. We have developed all the materials, and the manual patent is registered in outside Korea. This is our business portfolio. I just mentioned the molecular diagnostic, except the molecular diagnostic. We started from the life science research business, like the Thermo Fisher. We have a full the various product portfolio from molecular diagnostic, molecular biology research, and we now have more than 500 different kinds of the products from the siRNA and the nucleic acid extraction, PCR products, and the protein synthesis machines, and our the business part is a new drug development is operated by the Sonagen, and the probiotics business by the Ace Biome. Let me talk more about the COVID-19 assay. So we have two kinds of products. One is a closed system operated in our X station. The other one is open system. And we have a COVID-19 test kit and the COVID-19 and flu simultaneous diagnostic kit. And also recently we developed the COVID-19 variant identification kit. So I skip this one. And our kit is evaluated by the FIND, that's a WHO collaborator in the field of the diagnostics. And we have 100% sensitivity and specificity. And we have recently developed the variant ID kit. So still there are the COVID-19 virus fastly evolving even after the vaccination. So we are watching the variant, every variant, and developed the kit for the clinically important variant, the variant alpha, beta, and the variant kit ID kit 2 is we can also detect delta type. The current molecular diagnostics still have many problems, even though it is a gold standard for, as it is very sensitive and specific, but it takes some time. Just to mention the gene system, and it also have some the problem of the handling. The expert should handle this molecular diagnostics. So we developed the next generation, the ion qPCR, so it can be finished from sample prep to the result is just within 30 minutes. It can run the 2 samples, and the automatic extraction and real-time PCR can be done without any human intervention. And it's designed for the syndromic diagnostic, can detect a maximum of 40 targets. This is another next generation the molecular diagnostic platform we are developing will be launched this year. It's the really first generation molecular diagnostics. So because the sample tube can be loaded without the cap opening, the machines within the machine, the sample tube is decapped by the machine, so it can run anywhere, even in the office. So our growth potential, briefly introduced our drug development pipeline. We invented the semi-RNA. It's a next generation siRNA therapeutic platform. This is very unique because the siRNA therapeutics is a naked type or nanoparticle type by assembling the repeat nanoparticle. But our semi-RNA is a single molecule nanoparticle. It's a very unique feature. So it overcomes the major problem of the innate immune stimulation. So as you know, the Ebola virus, the therapeutics by siRNA is failed by innate immune stimulation because the major toxicity comes from the innate immune stimulation. So our semi-RNA is really free from the innate immune stimulation, so ideal platform for antiviral drug. This safety is confirmed in the preclinical study, including the monkey study. So it's a very safe profile. The NOAEL in monkey is 100 mpk, and the efficacy dose is just 5 mpk. So we have 20 times the safety margin. We have now the pipeline for antifibrosis, especially Korea industrial lung disease is the major disease after the corona pandemic. Many patients still have trouble with the lung fibrosis. So we will start this clinical trial in the next year. And this is our growth in the last 3 years. And we also invest a lot in the manufacturing facility for the next generation molecular diagnostic. So this is our patent portfolio in each business domain. We have a strong patent in the new drug development and the next generation molecular diagnostic platform. This is financial highlight, and our total asset is 224 billion, and the liability is 61 billion, and total equity is 163 billion. In the year 2000, our sales revenue is 206 billion Korean won, and OP margin is 52%, and this year's first quarters, the 36%. And this is our the diverse kit for our platform, and the diagnostic kit, and the competitive edge of our instrument in comparison with the Roche and the Thermo Fisher and Qiagen instrument, smaller space and then more throughput. That is our competitive edge. This is a head-to-head comparison of our instruments. We recently invented the AccuRoader for high throughput sample loading, especially for the pooled assay. This is very accelerated the large-scale screening. Thank you for attention.
Thank you for your presentation, Dr. Park. So we would like to thank all the speakers who participated in the presentation and discussion. Until now, Session 1, Development of a Domestic COVID-19 Vaccine, Therapy and Strategies for Global Advancement. Session 2, R&D Strategy of in vitro diagnostic devices and kit for COVID-19. We had passionate discussions and presentations on these two issues, which allows us to share mutually beneficial information. So we hope that today's event will serve as a stepping stone for promising domestic companies to enter the global biohealth market. So this brings us to the end of today's BioKorea Invest Fair 2021. The BioKorea Invest Fair 2021 will be conducted tomorrow from 10 a.m. with the topic of Session 3, New Therapeutic Strategies for NK Cell-Targeted Immuno-Oncology. Session 4, Bispecific Antibody Platforms for Next-Generation Cancer Therapy. And Session 5, Strategies for Developing Treatment for Rare Intractable Diseases using Artificial Intelligence. Furthermore, you can watch the presentation video again through the official website of BioKorea Invest Fair 2021 until June 21st. So please pay a lot of attention until the end of the event. So we are grateful to you who attended today's event despite of your busy schedules. And we also would like to thank all the participants who joined us online, even though they were not able to participate in the site. So I think I will have to say goodbye here, and we'll see you tomorrow. Thank you.